We are in a state-of-the-art facility here. It's just magnificent. And if you ever wondered whether athletics or healthcare has more money, you can just tell by the seats you're sitting in that we're losing the battle. Anyway, I'd like to thank Jeff Rudy, who's Director of Football Operations, and his entire athletic department for allowing us to use this facility. Also like to thank Robin Marcus, Dean of the College of Health, Trish Morton, Dean of the College of Nursing, and our new Associate Vice President of Health Sciences Development, Jay Vogelslang. And Jay, stand up and let everybody see who you are. And welcome. Yeah. Also to the Health Sciences Development staff, they're fabulous. Rebecca is the glue that keeps all this together. So, by the way, I'm Byron Barkley, and this is my wife, Deborah, and we're co-chairs of the Health Advocates. Just a couple quick facts before I give you the thing. The University of Utah Healthcare we've ranked in the top 10 for the last 4 years. Now, that is absolutely amazing. And number 1 in 2010. And the University of Utah Health Sciences has 10 community clinics. And these clinics saw 420,000 patient visits last year, or in 2013. Is that right? Already? 2012. Anyway. Let's see, and our hospitals and clinics had more than 1 million patient visits. Now that's pretty impressive. So I'll turn it over to Deborah. She'll give you the mission statement, and here we go.
Did you say we were 10th out of 120 or 140? 144 in the top 10 for the last 4 years. So that's pretty impressive when you think of how many people, other institutions there are. So I'm going to read the mission statement of the advocates, which is who we all are. And the University of Utah Health Science Advocates is a group of donors that is educated through a series of presentations and tours at the University of Utah Health Sciences Center. Members attend 3 to 4 presentations a year and are active spokespersons for the University Health Sciences. Active members give an annual minimum donation of $1,000 a year or a significant lifetime contribution to health sciences of $25,000 or more. Currently, the group consists of more than 100 people, including couples and individuals, who support the mission of the University of Utah Health Sciences. So just going over that. And then I have the honor of introducing Dr. Lee this evening. Come on in and there's lots of good spots up front. We are so lucky. We were just speaking with Dr. Lee earlier today, or this morning, or this evening, and she is absolutely incredible. So smart. We are so lucky. I know, so, you just are, I don't know, I think you're just amazing. So she's definitely a multitasker. She's a mother of 4. She gets up at 6:30 and gets on her treadmill and does emails. I know that. But besides that, she is going to discuss the vision of the University of Utah Health Sciences and the role of the College of Health and how the overall vision and how it works out. She's the Senior Vice President of the Health Sciences, the Chief Executive Officer of the University of Utah Healthcare, and Dean of the School of Medicine. And she holds 3 titles, MD, PhD, and MBA. So you are definitely a multitasker, and we're just very, very lucky to have you. So welcome tonight. Thank you.
Are those your glasses?
No.
Well, thank you so much, Byron and Deb. We are so lucky to have you in this role, and I want to extend a welcome to all of you advocates who are here tonight. We are so excited about what's happening at the University of Utah Health Sciences, and you know that it wouldn't be possible if it weren't for the support of people like you in the community. And I am personally very interested. I was talking to Byron and Deb in getting more connected with the advocates, and now that Rebecca is sort of acting as the liaison, I think we're going to be working closely to do that. And I think all of you have had a chance to get to know Rebecca, and she's just a remarkable individual, and so you're in good hands. and I look forward to getting to know each and every one of you a little bit better. Just recently, we put out our annual report, which I saw some of you had a copy of, and just, does this look familiar to anybody? I hope, because we sent a few out in the mail. Oh, good. So this is the second year in a row that we've put out this as our annual report. It's a little different from most business annual reports in that we've tried to design it to focus on big problems that we think most medical centers are dealing with, and then sharing some of our ideas about how we're trying to tackle those problems. So it's a very sharing kind of annual report. We have a little bit of bragging, but not a ton of bragging, more kind of sharing and trying to explore and find best practices across the country. So hope you'll enjoy it. We had a really crackerjack team on our campus put it together, so we're really proud of it. Now, as Deborah mentioned, we are really very pleased to be able to have this event tonight, bringing together the main campus, athletics, and health sciences. In fact, when I was sitting here looking, I thought we could just change that one word. It could say eliminate bad food, and then we could just take over this room. What do you think? No. Well, we are really grateful to the athletics folks for allowing us to use the facility tonight. And one of the initiatives that I'm personally very committed to, and I'm sure many of you would agree, is one that we're calling Putting the Health Back in Healthcare. And really recognizing the fact that in our College of Health, through our departments and divisions of nutrition, exercise and sports science, occupational therapy, physical therapy, health promotion, speech and community, there are all these areas, even parks, recreation, and tourism. They're all areas that we really want to promote for healthy living, and that we've been, I think, neglecting too much in our health system, where we mostly focus on illnesses. And so tonight's presentation is, I think, just a great example of the potential of further integrating the College of Health in the health sciences, both in research, education, and in really impacting the way we all live. So I just wanted to share with you one line, which was from, you remember Mad Magazine, Alfred E. Newman? Do you remember that sort of face? Okay, so here's Alfred E. Newman's quote. He once said, "We are living in a world where lemonade is made of artificial flavors and furniture polish is made from real lemons." So I think that's kind of what the challenge that we have in healthcare and in health. And I hope today that you will enjoy this presentation. So now I'm going to hand it over to Robin Marcus, who is the interim dean for the College of Health. She is a fabulous individual. I hope you all get to know her. She's in the Department of Physical Therapy. She was the head of the College Council for a while, and now has just taken on this role with great gusto and is really working hard to partner the College of Health faculty and talent with the rest of the University of Utah Health Sciences in a really exciting and energizing way. So I'll ask her to come up and introduce the two speakers today. So thanks very much.
Thank you, Dr. Lee. Welcome, everybody. I need to give you a little bit of background. First of all, about the building itself. I remember not too long ago, and it seems like it was really not very long ago, where the building that this replaced was new, and I was just so jealous that I couldn't teach my physical therapy students in that building. Now I'm just a little irritated, I gotta tell you. No, I'm really pleased to be here too, and it's very exciting. This is actually the first time that I've been in this building, and as you are, I'm sure, I'm very impressed. As Dr. Lee said, I'm a faculty member in the Department of Physical Therapy, and I need to tell you that as a physical therapist, which I was trained as a physical therapist before I became faculty and before I became an interim dean, my interest area really is in mobility and physical activity in older adults. One, because I'm personally interested in that, but also that's the clinical group that I've treated for many years. In fact, I think I've presented to the advocates a few years ago. And one of the things that I'm a little bit embarrassed about is physical therapists are very interested in muscle and mobility and the nerves and the way the muscles are run. And we have, for many years, neglected the very important piece that we're going to talk about tonight. and that's nutrition. And I'm now enlightened and have become enlightened over the last several years by my colleagues who are sitting here in front of me and others that in order to move well, and we all know that movement is what keeps us alive, and in order to move well, we've got to have the right fuel, and the people that study the science of the right fuel and when we should fuel and how we should fuel are very, very important to us. And so I'm thrilled to be able to introduce these folks to you. And let me just tell you a little bit about each one of them. Dr. Julie Metos is the first speaker tonight, and she is actually our interim chair of the Division of Nutrition. She's also the program director for the Coordinated Master's Program in Nutrition and Dietetics and an assistant professor in the division. She completed her graduate work at the University of Utah with a BFA in ballet. So Julie came here to study ballet. And she had a nutrition minor, or excuse me, no, a BS in nutrition at the time. She also has done master's work at the University of California, Berkeley, and she did her PhD in public health here at the University of Utah in the School of Medicine. Her career includes public health and clinical nutrition management positions, and most recently, her work examines the influence of school nutrition and physical education policies in adolescent obesity using population data from the Utah Population Database. One last point about Julie is she is passionate about students, and the students report that she trains them to change the world through food and nutrition. Our second speaker is Beth Wolfgram, and Beth got her she's also a registered dietitian with a Master's of Science degree in nutrition from the University of Utah. And she had her bachelor's degree in exercise and science from Northeastern University in Boston. Beth is a board-certified specialist in sports dietetics, and she is the sports dietitian for the University of Utah Athletic Department. And I want to point out that that means that she is overseeing 17 sports and 400 athletes here at the University of Utah. She is also an adjunct faculty member in the Division of Nutrition and has been so for the last 13 years. And then we've actually have added one person to the docket tonight, and that is Tracy Thompson. And Tracy is the director of the Peak Health and Fitness group that is in our Exercise and Sports Science department here in the College of Health. And Tracy is also a master's trained exercise physiologist, and she runs Peak, which is the clinic and I'm not going to steal your thunder, Tracy, but the clinic that really carries out a lot of what we're going to talk about tonight and rolls it out to people in the community beyond the University of Utah. So with that, I'll hand this off to Julie.
I'm mic'd. It's really great to be here. It's really fun to see all of you. And I was super excited that your leaders told us that you wanted to talk about fad diets. Then we decided to have it in this building, and then everybody wanted to know about football and players and what they eat. So we tried to put together a really creative presentation where we combine what you can learn from fad diets and also from athletes. So I think it'll be a great way to talk about nutrition. Here's our presenters. And what I really want you to do tonight, just for a few minutes that we have together, is think about your eating. You know, eating is something that kind of gets in the way sometimes, or it can be really enjoyable, but it's oftentimes something that we do without thinking too much. So this is just your moment to have mindfulness about eating, and maybe absorb a couple little tips that you could take home. So the take-home goal is that you'll develop a personal eating style for health over time, but tonight maybe just a few little pieces, using a blend of scientific evidence and personal evaluation, and utilizing some of the resources available at the U if that will help you meet your goal. So the first thing about diets, and I'm going to kind of use the term diet as like weight loss diet or a diet for health, and actually dietitians, even though diet is in our title, we don't really like the word diet. We're not that into it because it's die with a T on it. You know, it really doesn't, it's not a happy place diet. So what we really like to do is we like to use terms like your eating style or your pattern of eating. It just sounds a little bit better. But we'll say diet tonight just to go with the theme. But what everybody wants to know is what works. And here's what works. We know from the National Weight Loss Registry that there are some things that people that lose weight and keep it off do really well. And how they gather this information is they ask people that have lost at least 30 pounds and kept it off for at least a year to give them some information. And they don't stack it, it's kind of open-ended, qualitative type stuff. And this is what they found out. People who lose weight and keep it off modify their food intake. Oh, that's such a surprise, right? These are not like things that are going to blow you away. 94% of them increase their physical activity. This is kind of interesting. This was more for the people that kept their weight off. 90% of them exercised about an hour per day. It is known in the research that it takes quite a bit of exercise to keep your weight off after you lose a significant amount of weight. You got to stay at it. 78% eat breakfast. That just is like, oh my gosh, that's so boring. We already know that. But there's something in there. The research shows that our metabolism works a lot better if we eat breakfast. And we really know that down to the cellular level. So, maybe you are a person that could start doing a little bit better with breakfast. You eat less later in the day when you eat breakfast. You feel more full. You actually perform better. 75% of the people weigh themselves about once a week. So this kind of monitoring that one needs to do is sort of important. And TV watching, only 62% of them watch less than 10 hours of TV per week. So, some of the things you've heard before really are substantiated. Okay, what we're going to do next is go through a little history of fad diets. Now, this is not a diet. It's actually exercise, kind of. But the woman on the right, I think she's measuring their food. I'm just going to pretend that if it's not true. And this is a really popular theme in fad diets, is that you do something that just seems like it should work, like shake your fat, right? And then people put you on a really low-calorie diet, and then they say, oh, look, that fat shaking worked. But it really probably was the modified diet. So here's some other ones that kind of give us a little sense of history. Yeah, that's Oprah, but we'll get to her. In 1903, the Great Masticator. So you know that idea that you're supposed to chew your food well? Well, this guy wrote a book about chewing your food at least 30 times and then spitting it out. And you could lose a lot of weight this way. Terrific. But I think there's a message in there. Chewing your food, enjoying it, actually in behavioral studies does make you eat less. The hay diet. I put this one in there because Beth gave me a slide on the hay diet, and it's kind of like some diets you still see where you have to separate your food. Okay, so you put the protein food over here, and you put the carbohydrate food over here, and oh my gosh, you better not let them touch. Okay, we see that still sometimes, and that's really not the way the body works. The body likes it all kind of mixed together, and the reason is because protein and fat make you feel full. They're satiating. And fiber and carbohydrate is satiating. And when you put them all together, you can last longer without eating. It's just a good general way to mix up your food. The calories don't count diet. Now, this goes way back, right? But isn't that, they still have ones with those titles. Calories don't count diet. So what did you do on this diet? Well, you could eat whatever you want, which they all say is great. You can eat whatever you want, but just take this little olive oil pill. Okay? Oh, but the thing that you can do is you can eat whatever you want from this list of foods. Eat whatever you want from this list of lettuce food type foods. Yeah, that's kind of another theme. And then the Dr. Atkins diet early on was a very high protein diet. More recently, it's actually a lot more balanced diet. So if you went to the bookstore and bought the Atkins diet right now, it might be a little bit more favorable scientifically. And then there's a whole category of liquid diets or fasting. And these went more from a fad in the 80s to something now that's used more medically. So it's used with bariatric patients or by itself in a hospital setting, along with behavior modification and exercise and long-term support for moving back into food. But there was a whole category of those. And this is Oprah. When she did opt to fast in 1988, she lost about close to 70 pounds. One thing that's funny is this will date you. Like in our classes, Beth says she's shown this slide, and she said that the kids are like, "Who's that?" And then they're like, "That's Oprah," and they're like, they have no idea she ever lost a lot of weight. But this picture exemplifies how it's difficult to keep up those behaviors sometimes. So they need long-term support. Okay, so then the next thing I did is I went and found the 3 diets that are the best sellers right now. And I'm going to tell you the pros and cons. This is Wheat Belly. So Wheat Belly, first of all, you remove all wheat from your diet and eat modestly. This will help improve diabetes, weight, and overall health. So what can we learn from this? Well, there's some pros in here, right? You can always lose weight by eliminating a food source. That's a given for a while until you figure out how to replace it. It expands your diet. Okay, so maybe in the United States we do eat too much wheat. Like maybe that we're relying on one food source too much. Wouldn't it be great to have a little more rice or a little more barley or a little bit more of all the millions of different kinds of grains there are? That could be great. And eating modestly and portion size control is always kind of a dietitian-y good idea. But the cons is that it's just not demonstrated in the peer-reviewed literature. It doesn't really have a scientific basis. And it kind of takes one diet, which is the diet for celiac disease, and promotes it for all. That's another theme you'll see in fad diets. Is this diet harmful? Probably not so much, but it is relatively, or more than relatively restrictive. The next one is paleo. Raise your hand if you've done no paleo. Okay, yeah, a few paleos, yeah. Okay, well, the interesting thing is the paleo diet, when you look at it, it comes and goes. In the 80s, it was called the caveman diet. It's been called the ancient diet, and it's always kind of the same, which is interesting. But the idea is that we should eat like our caveman ancestors to lose weight and be more healthful. It just has this kind of ring to it, right? Like nostalgia, go back, we were always better before. And it does highlight vegetables, lean meats, fish, nuts, seeds, and healthful oils. Hey, that's all good. It eliminates sugar and limits salt. Probably Beth will talk a little bit more about eliminating things. Really turns out it doesn't work so well. Because when I tell you to eliminate sugar, well, if I tell myself to eliminate sugar, what happens in my brain? M&Ms, 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 all day long, until I can't stand it anymore and I go and buy a full bag, a pound bag of M&Ms. And that's just like being silly, but really it doesn't really pan out in the literature behaviorally that we can operate real well by eliminating something. On the cons, this will get every dietitian in the world. When you eliminate legumes like dried peas and beans, we go nuts because we think those are like wonder foods. But they have a little starch in them, but they're a really healthy food with lots of nutrients. It eliminates grains, dairies, potatoes, most fruit, and all processed foods. Some of that could be good, but it's very, we think fruit is probably pretty good. There's really not a lot of evidence in the peer-reviewed literature, although there is some evidence for eating more protein than some people do right now, and less sugar, of course, than most people do now. And anthropologists don't really even like this idea. They say that this doesn't really make sense in anthropology or evolution or anything like that, that we would want to go back and eat a paleo diet. This one's called flexitarian. The point of this slide actually is that diets have really gotten a lot better. Most of these that I've gone over so far, they're not going to really hurt you per se. And the flexitarian diet is a way to eat almost vegetarian. It's a really low-meat diet. Kind of meat as a condiment is how we say it. And the flexitarian diet encourages you to eat more fruits and vegetables, eat less high-fat meats, be flexible based on your surroundings. So if you were at this event tonight and you really thought it'd be fun to try the duck sliders, but you're vegetarian, well, you could be flexitarian, and then you could give it a try. I think there's something about being flexible around food that makes us more gracious. So I think there's something lovely about that. It's really based on solid science. I mean, if you looked at the field of nutrition, really a low-meat, high-vegetable kind of diet is really kind of it. It's not necessarily a weight loss diet, though. I can tell you plenty of vegetarians and flexitarians that eat a lot of French fries, and they don't lose weight. And it's probably really restrictive, and if you've been raised culturally on a meat-based diet and that's your comfort, it might not be perfect for you. The last one is the Eat to Live diet. Any takers? Anybody know this one? This one's really popular right now. It's on the bestseller list. If you Google it, it's really rich in sales and marketing terms. It's really desirable that way. It looks really flashy. And I love this because one tip on helping people change their diet is just keep it simple. So he keeps it real simple. Eat a pound of vegetables, eat a pound of fruits, and limit your grains and starchy vegetables. Have a little olive oil and no meat if you can. So it's kind of restrictive, wouldn't you say? But it does have some good points. We could all stand to increase our fruits and vegetables, and it focuses on healthful oils. It's pretty restrictive. Whenever it's this restrictive, it's pretty hard for people to do for a lifetime, and that's really the preference. As a matter of fact, I always tell my clients, let's find something that you can do forever. Okay? Let's find something that's not an on again, off again, because why work so hard if you're just going to give up on it? You know, there's some exceptions. Some people like to do something for a while to get a kickstart and such, or if they have a lot of weight to lose, that might be appropriate. But generally, you want to work hard at these behaviors, and then you want them to stick, not try something different. So I'm just going to finish by telling you a little bit about recent research. So everybody comes and asks me, is it better to have a low-fat diet, a high-fat diet, a low-protein, a high-carbohydrate? You know, there's 3 macronutrients, right? Fat, protein, carbohydrate. Now, a mathematician could tell you how many times you can mix those together. It's not a whole lot of times. But what we do in science is we figure out all the ways to test these with clinical trials. And all of the meta-analysis on all of these kinds of trials is that, guess what? Every kind of routine works in helping people lose weight and improve their metabolic factors like cholesterol, hypertension, etc., their overall health. It doesn't really matter. Does that kind of freak you out? Sometimes it kind of freaks me out because I can read whole journals on different ways to combine these things. But it turns out if you follow it for a while and you reduce your calories and you do some of these things, they kind of are all the same. So what's the point? The next thing I'm going to tell you about is an editorial that was in the Journal of the American Medical Association recently. And I thought that was pretty interesting. It kind of goes along with my philosophy. And they said, would you just please stop funding macronutrient-based weight loss studies? Because what we really need to do is figure out how to help people adopt these healthful behaviors and change their unhealthful behaviors and do it for a long time. And by continuing to put these things in the media about debates, it just confuses everybody. And in science, there's not really a debate, but where they're confusing the public, and it does nothing except to reinforce the diet industry. Kind of powerful. And so what they say, and I would agree, is that these types of lifestyle interventions where we really help people for quite some time, this isn't like magic actually, in our clinical practice and in our communities, we need to really scale things up. So what we have around us are healthy choices, like when you go upstairs or the food we had tonight, there's lots of different healthy choices, and we make it the easy choice, and we make it something that people can really do and have success so they're not on a diet, off a diet all the time. Now, the last question you might have is, what are the best diets? Well, there are some diets that are really kind of boring, to tell you the truth. Like, they're not, as flashy as some of the other ones, but they're evidence-based. Probably the best overall diet, if you wanted to go buy a book at Barnes & Noble or another local store, would be the DASH diet. The DASH diet was designed to reduce hypertension. It's a National Institutes of Health thing, so you actually can Google it and get it for free if you want. And it talks about very specific recipes and menus that really do a high fruit and vegetable diet, lots of whole grains, less meat, very low, of course, moderate in sodium, and very high in certain minerals that help with hypertension. And then the next one is one that people get exposed to when they need to lower their cholesterol, but it's a good one. It's the TLC diet. It's something that would be great for everyone. It's very similar to the DASH diet. The one that's the most fun on this list is the volumetrics diet. And this is a person who has a lab where she kind of studies what people eat and how fast they eat, and if she can trick them into eating things by changing the volume and the look of it. And so she has a book where she shows you pictures of food and shows you can eat this much of this food because it's very low in calories and water-based, but tastes great, or you could have this much of this food. And it's just it's very educational, and there's diet plans in there as well. And Weight Watchers has a very good research and development staff, and so it's always a good choice if you like to do something online by yourself or with group support. So these are some of the things I talked about that make successful and safe eating plans. There's always physical activity, nutrition education, and behavior modification. Those are the triad or the tripod of eating plan, healthful lifestyle. You set realistic weight goals, about 4 or 5 pounds a month. You help people evaluate their fullness, satiety. It usually doesn't eliminate certain groups of food. Has some science behind it. Anecdotal, case study kinds of information like your neighbor. Take it with a grain of salt. Screens people for health risks. You probably should get a good physical before you go on a pretty radical diet. And it usually has a multidisciplinary team. Some of the most important members of the team are people that can help with behavior, that can help motivate you, going to see them regularly to just kind of keep you going. Now, I have a test for you. Can anybody name a diet of the 1990s? Anybody name one? Beverly Hills diet? Is that, yeah? South Beach, yeah. So there's lots of different diets, and they come and go. I think maybe this presentation will show you a little bit of what to look for, and also how things come and go and kind of rotate through and have themes. So Beth's going to talk now, and she's going to talk about what the athletes eat and how she set things up here. And I think this kind of puts it into more the practical terms of what we would like for you to do on a regular basis. Thanks.
Well, thank you for having me here tonight, and I'm actually really excited that everyone is here in this facility because there's been several years of a lot of work put into the dining hall and our fueling station and everything in here, but I'm pretty proud of the nutrition changes that we've made and the impact that we have with the athletes here, so I'm really excited everyone is here, so thanks for coming. And what I'm going to talk about is kind of a spin-off of what Julie has started with, and talking about eating plans and kind of what is the best approach, not only if you're trying to improve your overall health, if you're active, and just general principles that you may be an elite athlete, like our jazz players, or you may be someone who walks around the block 2 or 3 times a week, or you might be someone who's just trying to improve your overall relationship with food and trying to be healthier. And these principles carry over. So some of the things that I focus on here with the athletes, I try to keep it really simple and keep it doable for them. I'm working with pretty much 18 to 20-year-old student athletes who have a real broad spectrum of nutrition knowledge, and sometimes it's not really a priority for them. And so I'm trying to keep the messages simple and things that they can do. So the things we focus on, and these are the areas that I'm going to talk about tonight, is food as fuel and timing and moderation and hydration and enjoying your food. And these are things I think we can all learn from. So the first one is food is fuel. This is kind of a quote we say a lot. We post in different places that basically what you eat essentially is what you're going to get from your body from an energy standpoint. So there's nothing else that fuels your body besides your food. And if you fuel it with good, healthy foods and fuel it in a positive manner, then you're probably going to have more energy and you're going to be able to do more. Your body's going to be able to do more. If you are eating Doritos and Cheetos and ice cream, which some of the athletes come in and say, oh, I'm performing just fine, and I didn't eat lunch, or I had a bag of chips for breakfast. And sometimes that does happen. I say, well, can you imagine how much better you would feel and you would perform if you ate better, if you had better fuel? So we talk about food is your fuel. And essentially, food does a few different things to kind of break down the science. Obviously, we could get into each macronutrient and each vitamin and mineral, but the reality is you can break it down to these 5 areas. Food gives you energy, so it provides you calories. It helps delay your fatigue, so it helps you keep going through the day. What you put into your body at 8 a.m. is still helping you maybe at noon, and then you refuel, and then it's helping you as the day goes on. If you're someone who's active, you're doing a bike ride or a hike or you're running, your food is helping to delay that fatigue that will set in at some point. enhances your recovery. So we focus a lot on recovery here with the athletes, and I think it's a message that we can all take with us, that if you've just done a workout, if you've just done a walk around the block, if you've just done a strength training session or something, then what you put in your body after can either enhance or detract from your recovery. So we focus a lot on recovery. We obviously focus a lot on injury prevention and helping the athletes stay healthy. And this goes for all of us. Like, we all get aches and pains and tweaks and things that maybe don't feel so right, especially as we start to get older, maybe some stiffness and things like that can happen. If you have surgeries, you're recovering from different injuries, then what you put in your body can enhance that recovery. And this goes along with the physical therapy and the athletic training, and we work together as a team to enhance the athlete's recovery process. And then big one, of course, with athletes is increasing muscle mass, maintaining muscle mass. But I also think this is an area that's important for everyone. It's shown that our muscle mass declines as we get older. That's just a naturally occurring process, but we can prevent that through the activities that we do, the type of activities and the amount of activities, as well as what we eat. So these are the areas that we focus on with food as the fuel to fuel everyone from soccer to volleyball, football, tennis, everyone. So obviously each athlete in different sports has very different needs depending on their particular sport, their particular position, how much they play, what their body weight is, their genetic makeup. So there's a lot of intricacies when you're working with athletes, but the principles, the overriding principles are very, very similar. And what we focus on is similar to what Julie just talked about, is really a balanced meal plan and a balanced way of eating. That we need carbohydrates, you need to have some protein, you need to have fat, and you need to have fluids. And it doesn't sound really fancy. It's not some flashy diet or some meal plan that you may see as a, get strong in 2 weeks or lose weight in 2 weeks kind of plan. This is a lifestyle. And this is another thing we're promoting with the athletes, is to not only fuel where they're at now with their athletic career, but what can they do for the rest of their life, helping to teach them lifelong skills that they can take with them after athletics. And really that's what all of us are trying to do in the health field, is help people make lifestyle changes that they can maintain and live with. So we focus on, a balanced diet, and we do things like the plate. Has anyone ever seen this plate? Yeah, so I have this in my office, and I use this in different capacities for different athletes, depending on what their needs are. Some athletes may need to gain weight, some may need to lose weight, some may need to maintain. And so we kind of look at different proportions of what you need, but you still need all of these areas. And as much as you would think maybe the athletes would be a little bit more educated, you still find that there are myths and perceptions that maybe they don't need a certain type of food or a certain type of nutrient, or like I was just upstairs, if anybody was up there and saw, we had wings tonight, and we have them like once every couple of weeks. And I noticed the wing line, there were like 15 people in the line. And I went over and looked at everybody's plate, and I was like, I don't see any vegetables on here. And one of the guys said, well, there's a little piece of parsley on this wing. And I was like, that doesn't cut it. So I scooted them all over. I said, you guys need to go over and get some veggies. And they always went, I don't need veggies, but that's what's the healing, the nutrients, the vitamin C, all of that kind of stuff. You need it to be healthy, essentially. So we promote something like this with a little bit of variation for different athletes. Next thing we talk about is timing. And I think this is something that is important no matter where you're at in your life and your activity, how busy you are in your day-to-day life. Sometimes food can get maybe in the back burner, and you remember it later on. You think of it, it's 4 o'clock, I'm starving. And this has been a really big advancement in the field of sports nutrition and helping athletes, and something I think we can all really learn from. What you fuel is important, but the timing of it is really important. So there are some very specific guidelines of when to provide your body different nutrients based on when you're going to be performing. So for example, we don't serve donuts to the football team at noon on Saturday. Probably not the best idea with the game at 2. So there's obviously some very important principles of timing. But what helps people when they think about timing is to think of it ahead of time, what your day is going to be like. And I think this is important for all of us. If you walk out the door, run out the door, maybe you've got kids, grandkids, you're rushing to work, you're doing something, you've got errands, you're busy, and you haven't planned what your day's going to look like, you can get caught without food and realize, oh my gosh, it's 2 o'clock and I'm starving, and what do I do with that? So we teach athletes to plan ahead and to always have something with them, and to plan to eat every 2 to 3, maybe 4 hours, depending on the athlete and their needs. So most people can probably get by every 3 to 4 hours having something. Athletes might be a little bit different, might need to be more often depending on how their energy expenditure is. But this is a really important principle, I think, for all of us, is we need to eat something every few hours. And people say that if they eat breakfast, for example, Julie mentioned breakfast being important. Oh, well, I'm hungry 3 or 4 hours later. And I look at them like, well, then you're totally normal. That's great. You should be hungry 3 or 4 hours later. That's pretty normal. But if you go the whole day and you're ravenous, by when dinner comes, what usually happens if you haven't eaten? You open the cupboard and you eat whatever there is while you're making dinner, and then you still didn't feel satisfied, so then you open something else and you have dessert, and then it becomes an eating frenzy the whole night, right? So eating regularly, having carbohydrates, having protein, and a fruit or vegetable, I say timing all of that together can really help with satiety and helping you feel like you're not deprived during the day. And a lot of people, athletes particularly, skip breakfast because they're trying to get a little extra sleep. I don't have time, I'm rushing to class, I just don't have time. And the reality is that breakfast does not have to be, I tell them, it doesn't have to be a sit-down meal with a plate and a fork and a spoon and a glass and a napkin and at the table, and it doesn't have to be leave it to beaverish. It can be running out the door with something that's quick and easy. We now have a fueling station, which I believe after this we'll walk around and look at some of the nutrition in other areas in the building that has really helped with this in terms of breakfast. So it's a fueling station that athletes can come and get specific snacks that are NCAA approved that provide this, a carbohydrate, a protein, and a fruit. We don't have vegetables, but we do have fruit. And this helps them with a breakfast. This has been a big, big change with breakfast. So, overall, if you're getting something to start your day off, you're going to be much better later in the day, as Julie mentioned. Your metabolism is going to be boosted. You're also going to have better energy, and you're just going to feel better. Getting the majority of your calories during the day is another thing that I really promote with the athletes. It's that whole not going all day long and depriving yourself and then having the eating frenzy. Eating more whole foods. This one sometimes is a little hard. I had an athlete in my office today, as a matter of fact. She wrote down what she ate for the day just to show me. And she had a Pop-Tart, she had a can of soup, she had a hot dog, and a bun, and that was just like breakfast and lunch. And I was like, oh, obviously not a lot of whole foods, but she also was someone who hadn't been raised on whole foods, so it was really a new concept to her. So it wasn't like I could take everything she was doing and discount that, but we have to start slowly and gradually introducing some whole foods, some fruits and vegetables, maybe some rice, some things that were not quite so processed. And I think that can be a little bit challenging when you have a busy schedule, but it's a good message for all of us, just from a nutrient-dense standpoint and overall nutritional value. Another one that I think is really hard in our culture is listening to your body and truly listening and being connected. We're all so disconnected. We're on our phone, we're going here, we're there, we're talking, we're multitasking a lot, and that can make us very disconnected from our overall hunger and our fullness in our body. And I think that can be something that's just hard culturally to introduce and to implement. But if you really are truly listening to your body and eating when you're hungry and then stopping when you're full, which is not easy to do, then you're fueling your body the best it needs to be fueled. We get caught into, we eat when we're hungry sometimes, but we also eat when we're mad, sad, glad, we had a good day, we had a bad day, it's a celebration, it's a party, we're frustrated, we made it through the day. We eat for lots of different reasons. And that emotional eating is fine every once in a while, but if it's something that has been done on a regular basis, then you're probably not listening to your body and working with it as best as possible. This is a hard one to teach the athletes because with them, a lot of it comes down to timing, and you've got to stagger eating with training and with lifting sessions and school and that kind of stuff. So this it's called intuitive eating. And it makes sense, and there's a lot of science behind it. It makes sense, but sometimes it's just hard to do with our lifestyle. But it's a great way to go. And then not overly restricting calories. And, Julie talked about this, or going on crazy diets because they don't work. So just like the athletes would do, I would promote for everybody that everything in moderation. And that may mean occasionally the wings, like we had upstairs. I actually didn't know we were going to have them tonight, and here we have the picture of them. Desserts, having that kind of stuff, there's nothing wrong with it. And I encourage the athletes to have those type of foods and do it in moderation. So we use something upstairs called the stoplight system. And this is an easy way of communicating a nutrition message. And I think, there's lots of fancy things out there. You'll see different star systems, and obviously you see the nutrition label, and you see different guidelines. And there's a lot of really good information out there. But for the average consumer, it can get very overwhelming, and it can get hard to decipher. So what we've done is simplified it for the athletes, but I think it's a good message for everyone. We use this system of green foods are basically things that they can eat all they want. Typically, fruits and vegetables fit in that category. Lean protein, like a grilled chicken or some type of other lean protein. Yellow would be foods that we encourage them to have. They need them still, but maybe not so much. A little bit more cautious. Maybe this would be like pastas and rice and cereal. A little higher fat cut of meat, a little higher fat dairy sources. Still need them, but just don't overdo them. And then the red foods are the foods that are typically higher in calories, higher in fat, might be like a higher calorie dairy option or a higher calorie meat, or maybe like sauce or some type of dressing, or even a dessert or some type of like a soda, a drink that maybe is not so nutritional based, but still tasty. And so what we work with is this stoplight system is that you can have all of these, but you just have to be careful in how you build your plate. And there's nothing wrong with the red foods, and having them makes food enjoyable and makes it pleasurable and brings a sense of overall satisfaction to a meal, but you don't want to base your whole meal on a red. I can guarantee you that most of them tonight went right to the wings, and that's why I was up there like, back over to the salad bar, please. Like, shoot, she got me. But there was one, when I was designing the dining hall, we actually designed it so that the first thing you walk into is the salad bar, and the dessert's way over in the corner. And that's not by fluke. That was the design to kind of market the veggies and the fruits so that they stopped there, and then they went and got their meal. And then dessert is still there, but you have to walk over and you have to think about it. There's also some other subtle things upstairs that, like, we don't have soda. We work with the chef to design the recipes so that they're still tasty, yet maybe a little bit lower in fat, or maybe have some other ingredients in it to alter the nutritional value, either a little bit higher or lower in calories, higher in nutrients and lower in calories. So there are some things that we can do to advocate with that. But this is a great way to just think about overall eating. We also focus a lot on hydration. And I think this is an area I'm really finding out a lot about. I thought I knew a lot about hydration until we started testing the athletes' hydration status this year. And I felt like a lot of people probably are walking around dehydrated. Now I feel like probably everybody is because it's really amazing. We purchased a little machine called a refractometer, and it's about this big, and we have the athletes give us a little urine sample. And this is the fun part of my job, yes. And luckily, I have some help. We work with the graduate students in nutrition, the coordinated master's program. The students that are in the sports emphasis come work with me for an entire year, and they get some great experience, and they're also really invaluable to helping to service the athletes because there are so many of them. So we have the coordinated master's students, and we also have a fellowship program, which is for entry-level sports dietitians. And this is not only to help give them experience, but to help me with servicing all the athletes. So we do hydration testing on them. So they pee in a little cup, and we put a little drop of urine on a machine, and it gives us a reading immediately. So we know immediately if they're hydrated or not. And so all of these things that hydration affects, obviously it affects an athlete, but it affects us in our day-to-day life too. And you really see a big difference if someone's dehydrated. We often tell people to use this chart. And what I'm finding, though, is that even if you're kind of down in here, you're actually probably a lot more dehydrated than we realize. I just did a whole bunch of tests yesterday, and I think most of the colors were down this range. which, and this is after 3 months of harping on them and sending reminders and texts and asking them, carrying your water jug, and are you doing this, and can you drink more? So especially for football, it takes a lot to get them hydrated, but we even see the same thing. We do this with soccer and volleyball, cross country, and as a general rule of thumb, athletes are not drinking enough fluid, and I think if we were to test the average person, and no, we're not going to have everybody pee in a cup tonight, but we would find most people are dehydrated, and it does affect your performance in life. So, looking at the color of your urine doesn't sound very fancy and it kind of sounds a little weird, but it really can tell you some information about hydration. And so we focus a lot on hydration, but going back to the principles of food, we focus on food should be fun and it should be enjoyable. And you should like the taste of it, and it should be something that is pleasurable. So back to the principles of what Julie talked about is diets or eating plans that deprive you and are something you can only maintain for a short period of time are probably not going to be very conducive to lifelong changes. If it's something that eliminates your favorite food, then I say, well, ditch it. Then that's useless. When I see people in the grocery store and they look in my cart and they're like, oh my gosh, you have M&Ms. Like, yeah, I'm human. I like M&Ms. Yes, I'm a dietitian, but I eat chocolate every day. I just do. I don't sit down and eat the whole bag, because if I deprived myself of it, I probably would. But I have a little bit and feel satisfied with it. So food should be enjoyable, and we should be able to eat the things that we like and that bring us joy and help us culturally enjoy food and enjoy people with food. Yeah, this is a funny quote that, the reality is, we have to have food, obviously, to fuel our body, and having some balance in it is important, but we also want to enjoy it. So again, the principles we use is food is fuel, timing, moderation, hydration, and then it should be enjoyable overall. And, how we service all of these, the athletes, as I said, is through, the great program, the Coordinated Masters program that we work with the students, and they are in a program, a sports dietetic program there's only 2 of them in the country that they can do a Coordinated Masters program and have a sports emphasis, and we are one of those programs. So I feel very blessed to have the students. It's a great opportunity for them, but it's really amazing for me too to have students at such a high level be able to participate in collegiate athletics and get a lot of hands-on experience. Our students, literally, they get to do everything that I do. Some of it they may not love. Testing hydration status is not the favorite for everybody, but you got to do it. And what is awesome is that we are really leading the Pac-12. We are the only school in the Pac-12 that has a coordinated master's program with sports dietetic students. So these students are getting experience unlike anybody else in the Pac-12, and we're able to really kind of set some of the trends and what's going to be happening in sports nutrition. And I think it's a really, really growing field. And what's great is a lot of the principles carry over to the average person who is a weekend warrior or just trying to be more fit or take care of themselves a little bit better. So, and a lot of these principles that I've talked about tonight, you may be wondering, how you take some of the stuff Julie talked about and I talked about and put it to use, and how do you implement it in your own life, or where could you ask those type of questions, where could you go? And our next presenter will tell you a little bit more about that. Tracy is from Peak, and she'll take over. Thank you. Oops, sorry, Tracy.
Hello, good evening. I am Tracy Thompson. I'm the director of Peak Health and Fitness, and Peak is a clinic of the College of Health. So our purpose for being here is to give hands-on, real-world experience to undergraduate and graduate students in our College of Health programs, working with real people who have goals to improve their health. We are definitely on the prevention side of health. And because we have students working for us, doesn't mean that you're going to people come in and get somebody who doesn't know what they're doing. Our students are very, very well trained, very, very well educated. Most of my staff are graduate in the master's program or even working toward their doctorate degree in exercise and sports science, exercise physiology, nutrition. So we have a lot of very, very highly qualified, wonderful people who work for us. We have a lot of services, and all of our services are open for anybody to come in. We are located on the University of Utah campus, but we love to have community members come in. We do have a registered dietitian on staff, and we are a site for nutrition master's students to practice their craft. And so we do a bunch of individual and group nutrition services that anybody can come in to talk about if they want to try to lose weight or if they're just getting bored with what they're eating. One of the big things we do, and something that we've been doing for a long, long time, is health and fitness testing. So we will have people come in and do aerobic fitness testing, body fat. We can tell you how much body fat you have on your body and whether or not that is in a healthy level. This thing is called a bod pod, and it looks a little scary, but it doesn't fill up with water, actually. You sit in it in some form-fitting clothing, and it can give you a very, very accurate estimate of your body fat percentage. And once we know that, then we can talk to you about really, like, how much weight do you need to gain or lose to meet whatever your goals are. We do cholesterol testing. We can also test resting metabolic rate, which is an interesting one if you're looking to change your diet. Knowing how many calories your body needs to maintain at rest is a good initial step before you start making any changes in your diet. We do strength, flexibility, biometric screening. We also do a whole bunch of individual and group physical activity services. We offer personal training. We develop physical activity programs, so whatever it is that someone's trying to do, whether it's train for a marathon or be able to play with their kids a little bit better, we can help you train for that. We also work with a variety of businesses in the community, businesses and groups. Today we had the South Jordan Fire Department in our facility, and we ran some testing on them. But this is another opportunity for us to allow our students to get some real good experience out with community members. So, like I said, we are available to do services for the community, and when people come in from the community, that helps me to support more graduate students, which helps me to give them better educational opportunities, and it's really beneficial for us to be able to see people to come in and use our services. We do have a table outside with some information, a little brochure, and myself and a couple of my graduate students will be here after the talk and during the tour. If you have questions, we'd love to talk to you and answer your questions. Thank you.
Does anyone have any questions for our presenters tonight? You're welcome to pick their brains if you would like. Yeah, come on up. Angela has a question.
Oh yeah, we should. Come on up, Beth. What should you eat? I'm gonna guess. See if she said. What should you not eat? Well, you always want to have something with a little bit of protein and a little carbohydrate, and chocolate milk is one thing that's advertised that way and probably fits the bill, but I'll let Beth tell you the real answer.
Good answer, Julie. Typically, yeah, you want within the first 30 minutes of an activity bout, especially if it was something that was really intense, you want to get something as quickly as possible. And carbohydrates and protein together are the best combo on that. So there's a lot of different ways of doing that. If you're someone who can tolerate food quickly, then having a sandwich or, leftovers or, yogurt or string cheese and crackers or something like that. Chocolate milk is marketed as a good recovery because
easy and it's portable. So that is another option. But quickly, carbohydrates, protein, and within, I'd say, about an hour and a half to 2 hours, you should get a balanced meal. That's the best way of recovery. What not to eat? Brownies, cookies, high in sugar, fat, kind of like a occasional red item type thing. Yeah. Twinkies. Yeah. Yeah. I think that obviously depending on the particular bar, but there are a lot of different options now. And to me, they're another option. They can be convenient. They can be something that's easy to keep in a bag or a purse or your car if they don't melt. They don't really necessarily take the place, or they're not really better than real food, but they're convenient. And I'm realistic to know that people are busy and you can't always sit down and have a balanced meal. It just doesn't work out that way. So in a pinch, sure, having something like that would be good in a pinch. I think the better ones are ones like Cliff Bar, or we serve the athletes Pro Bars, which are whole food based and don't have a lot of added preservatives and stuff. But in a pinch, sure. But should you be living on bars? Probably not the best option. If someone's eating bar for lunch and a bar for breakfast and snack and stuff, then I'd say, maybe we need to focus more on whole food. So there's a place for them, in my opinion. Yeah.
What is the cost of participating in the wellness program?
We do, all of our services are different costs. So if you wanted to come in, for example, and talk to a registered dietitian, that charge would be $70 for a 1 hour consultation. You could get a bod pod for $35. So it's our services are definitely below market prices because we are an educational institution and we want to have people come in and give us experience doing those tests.
Oh, worse than others. I thought you were going to say better. Okay, here's the party line. Okay, in the dietary guidelines, the dietary guidelines are one way to look at it. But I think the research would say that moderate alcohol consumption is fine. And moderate usually means 1 to 2 drinks per day at the most. And the very best kind, I'll go for best, the best kinds are really wine. Wine has some of the antioxidants and the polyphenols that are anti-inflammatory, and those usually in the research end up being relatively helpful. And so the worst probably are the opposite of wine, like clear gin, vodka, stuff like that. So the one thing that we do know in working with students is that alcohol has a fair number of calories, especially when you mix it with fruit drinks, which is popular on campus for partying, and they gain a lot of weight. The freshman 15 is kind of a myth, but the freshman 5 is not so much a myth, and lots of the kids we see, it's because of alcohol, because they're adding it to their diet instead of using it, taking away something else or using it moderately. So red wine comes out the best.
And I would just add, make sure you stay hydrated. Hydration, yes. Yeah.
Well, we live in a really dry climate, but the standard is about 8 to 10 glasses per day, so a glass being 8 ounces. So that's kind of the standard, and that's maybe something you learned in health class. But here we think that people probably need at least 16 ounces more just for baseline. And the new thing is, of course, it doesn't have to be water, coffee, tea, milk, whatever. And that's providing that you're eating a lot of fruits and vegetables too, because they have a lot of water. So you want lots of watery foods as well.
That's a good question. Yeah, carbohydrate. Oh, go. I'll let you.
I think patterns is the biggest thing we see, like how many hours before you try to sleep that you eat, because you want your metabolism to kind of be slowed down. So what we usually recommend, like in the sleep clinic, they'll have people not eat for 3 hours before they go to bed. The second thing is that carbohydrate, so, we're not a really nice carbohydrate with a little fiber, so toast, whole wheat toast or something, has a little bit of serotonin, so the carbohydrates help you calm down. They calm down your brain. So that whole idea of having a glass of milk, there are some carbohydrates in milk, but maybe a nice piece of toast or a relaxing ritual, and nothing with any kind of stimulant, of course. Oh, chocolate milk.
Wow, I've never heard that one. Okay, the cure-all, chocolate milk. I've not heard that. I'm not sure what the basis of that would be. But I think chocolate milk, they've had a huge marketing campaign, the gut milk. And there's, milk is, I'd rather have people drinking milk than a lot of other things out there. I think it's a good option because it's a good source of protein. It's got calcium. The chocolate milk has a right ratio of carb to protein, has some vitamin D, it's a whole food. You can find it anywhere. It's not that expensive. It's not a fancy thing you have to mix or shake or carry. It's very good from a whole food standpoint. I don't necessarily think it's a magic bullet, but I think it is a really good option. And the other thing that comes into play, at least with my athletes, is palatability. Like, are they going to drink it? Will they tolerate it? Do they like it? And if it's something you really like and you can get in really quickly, then sure, it's a great option. But everybody's going to have a different option. And I think nutrition is one of those sciences that everything is very individualized. What works for one person doesn't necessarily work for the next. And you can take a lot of these principles that we've talked about and maybe take a few that work for you and try to implement them or try them. And you may find different things for different people. So I think chocolate milk is great, and if you like it, keep doing it. Yeah.
On the milk topic, are there any problems with soy milk or rice milk, or do you recommend one over the other? And I've read, women just have too much soy milk.
Do you want to do that one? In general? Sure, I'll do it. Sure.
We could have a show called The Battling Dietitian, see if we say the same thing. Okay, well, generally speaking, of the three options, like regular milk, soy milk, and rice milk, regular milk and soy milk have a higher protein content unless the rice milk is supplemented. So rice milk, unless it's fortified, it's really not super nutritious, and it wouldn't be something that you would have after exercise because it just wouldn't have enough protein in it. Now, soy for women, they need to watch how much soy, but it's not like none. So if you're a soy milk drinker, like 1 to 3 cups per day for a woman would probably be fine. It's only when women go like crazy on soy, like I'm going to be a soy fanatic, that they really run into problems. Yeah.
And obviously, I would say, I have a handful of lactose intolerant athletes who don't tolerate traditional dairy milk, so soy could be a decent option, obviously balancing out how often you have it, but that has the closest nutrition profile to dairy milk. So rice milk and almond milk and those other kinds of milk, they might be tasty and you can use them in things, but they don't have the same nutrition profile, essentially. Yeah. Oh, good one. I'll let you start with it.
You just cut us off when you need to. Oh, yeah, that's a great question. It's one that I answer quite often. Generally speaking, I would say that artificial sweeteners are only okay in very small amounts. So, for example, one thing that we know in the research is that if you add artificial sweeteners in place of sugar, you still maintain your taste, your intense taste for sugar. So what we find, and you might see this in your workplace, is that people drink Diet Coke all day, and then they crave a candy bar in the afternoon. Now, that has been kind of tested, and it's true. If we don't kind of moderate our taste for sweets by having less sugar and less artificial sweeteners, it might not help us in the end. Given that, if you have diabetes or if you're watching your weight, having one thing with an artificial sweetener per day is probably really reasonable. That's how I counsel my patients. And then there's some newer ones that are more natural products like stevia and things like that, where you could maybe go up a little bit higher. So my main concern isn't so much that they're going to hurt you, but that they're going to maintain your intense taste for sweet, and you won't modify that kind of behavior to help you overall.
And what I would, that obviously a great answer, but what I would also, add to that is that if you use the artificial sweetener, the intensity of the flavor is a lot more of sweetness. So when you go to have something that is traditional sugar, it's like you need more to get that same sweet, intense flavor. So that kind of tag teams what Julie was saying. It's like you need more of the real stuff to really kind of get your fix, almost, so to speak. And I'm traditionally more as much whole food as you can do. Real ice cream, real chocolate, whole food based, even if it is a sweet type thing, but in moderation, I think.
One more question.
Okay, last question. Yeah. Mm-hmm. So before exercise, a little bit different story. It depends on the type of exercise you're doing, what you can tolerate, how long it's going to be, the climate, that kind of stuff. But typically what I would say is things that are easy to digest, things that are easy on your stomach. So it's not the time for most people to sit down and eat a big bowl of oatmeal or high fiber food that might be hard on your GI system. Something that's easy to digest, a carbohydrate, very, very kind of light in protein, if any, light in fat. So it depends a lot on the person. I have athletes who can go upstairs and eat in the dining hall a huge meal and then go out to practice. And I'm like, crazy. And then other athletes are like, I can take a piece of toast and some peanut butter. So it really varies on your activity. But overall, it should be something you can tolerate, easy on your stomach, palatable to you, but mostly carbohydrates. So maybe a little bit of protein to it, but not a lot. So, and just to add, I think that was our last question, but I have Anna, who is one of my assistants, and Jill, who is one of our graduate students, who are here to help with tours of the fueling station and answer questions. So myself and them will be outside. Happy to answer questions.
Thank you again to our presenters. It was a really enjoyable presentation. We appreciate you being here. And we thank you all for coming tonight. I also wanted to recognize really quickly Jeff Rudy, if you wouldn't mind standing for just a second. I know you're back there. Jeff is the Director of Football Operations. And we just wanted to say thank you again for allowing us to descend on your beautiful building. It's just gorgeous, and we all want to move in. If you have any questions about the building while you're doing tours, and they're just self-guided tours, and make sure to check out the hydration station. But if you have any questions about the facility, please grab Jeff. He'd be more than happy to answer those for you. I also wanted to say, if you're here as a guest tonight, thank you so much for coming. We know it's a late evening, but we appreciate you participating and coming to the University of Utah Health Sciences event. And thanks for coming.